Welcome to this channel. Today is Tuesday, the 16th of July 2024. The theme of this video is the essence of physical exercise in preventing tackling type 2 diabetes mellitus, which may start from your belly fat and its underlying inflammation. The intermediary role that inflammation may play in pathogenesis of diabetes mellitus is crucial. Inflammation may start under the belly fat, which also starts what ends as diabetes mellitus. Interleukin 6, IL-6, and C-reactive protein, CRP, are two sensitive physiological markers of subclinical systemic inflammation associated with insulin resistance, hypoglycemia, hyperglycemia, and overt type 2 diabetes mellitus. Cross-sectional studies have reported increased concentrations of these inflammatory markers in both the insulin resistance syndrome and overt type 2 diabetes mellitus. The studies done with a sample size 1,047 subjects without diabetes revealed that over 5 years there was linear increase in the incidence of new onset diabetes and in the levels of inflammatory markers like fibrinogen, CRP, and plasminogen activator inhibitor. Also, interleukin 1, IL-1, is another inflammatory marker which is thought to play an important role in diabetes. IL-1 is a pro-inflammatory cytokine proposed to be involved in the autoimmune destruction of beta cells of pancreas of type 1 diabetes. IL-1 inhibits beta cell function and activates the transcription factor, nuclear factor NFKB, nuclear factor caprolite chain enhancer of activated B cells, thus inhibiting beta cell function and promoting apoptosis. IL-1 has also been implicated in the pathogenesis of type 2 diabetes as chronic inflammation contributes to the failure of beta cells to secrete sufficient amount of insulin. Discrete insulitis in type 2 diabetes is thought to be due to the pathological activation of innate inflammatory systems by metabolic stress, which is regulated by IL-1 signaling. Interleukin-1 production has been noticed in pancreatic secretions obtained from subjects with type 2 diabetes. High glucose levels in the blood increase beta cell production and increase the levels of IL-1, thus causing functional impairment and apoptosis. The studies of Close et al. Confirm the role of IL-1 in type 2 diabetes. He demonstrated that IL-1 antagonism resulted in improved glycemic control in subjects type 2 diabetes. Adipose tissue increases production of TNF-alpha, tumor necrosis factor alpha, which contributes to the insulin resistance. TNF-alpha and IL-1 also stimulate the production of IL-6. Regular exercise prompts and increases the secretion of anti-inflammatory cytokines rather than pro-inflammatory cytokines like TNF-alpha and IL-1 beta, which are contributors to development of diabetes. Other anti-inflammatory cytokines that are increased in circulation during regular exercise are IL-1RA and STNFR. A multidisciplinary study to reduce body weight in obese women through increased physical activity and low-calorie diet indicated reduced levels of IL-6, IL-18, CRP, C-reactive protein, and increased levels of adiponectin, which has anti-inflammatory and insulin-sensitizing properties. There are reduced leptin levels for individuals involved in regular physical exercise. These leptin levels are associated with CRP. In obese individuals, augmented adipocytes produce more IL-6 and TNF-alpha, than do abdominal subcutaneous adipocytes, consequently causing reduced levels of resting IL-6 and TNF-alpha, ultimately CRP production. Physical activity also reduces inflammation by improving endothelial function. Exercise reduces peripheral inflammatory markers of endothelial dysfunction such as soluble intracellular and vascular adhesion molecules, granulocyte, macrophage, colony stimulating factor. Regular physical exercise also preserves nitric oxide availability, therefore improving endothelial function. Thank you for watching and listening. Goodbye.